Hello, I'm David Gordon-Koch, reporting for the NB Media Co-op. With an election coming up later this year, the privatization of healthcare services is under scrutiny in New Brunswick. Companies that provide temporary nursing services have been especially controversial. Last month, the Globe and Mail reported that public spending on private nursing has skyrocketed since the start of the pandemic. One of those companies, Canada Health Labs, reportedly charged fees amounting to roughly $300 per hour, or roughly 6 times what a nurse on staff at a hospital in Atlantic Canada typically earns. New Brunswick's Vitalité health network was that company's biggest client. The leaders of the provincial Green and Liberal parties have spoken out about the issue while holding consultations on healthcare across the province. At a public forum in Moncton held by Green Party leader David Kuhn, the threat of healthcare privatization was a theme.
It seems like every time you turn around, you see another part of healthcare management being privatized. We've got travel nurses now who are managed by and delivered by private companies. This is causing a significant increase in the costs for delivering healthcare. It's creating more silos.
With chronic problems in the healthcare system, such as long wait times, Premier Blaine Higgs has stated that all options are on the table, including more privatization. And in a phone interview with the NB Media Co-op, Minister of Health Bruce Fitch defended the private delivery of services. But there are long-standing concerns from organized labor and other groups that more private delivery of services will actually make the system worse. But not according to the Minister of Health.
Is one of the prime examples of where a private enterprise has alleviated backlogs and wait times is our cataract surgery projects. And we started that in Bathurst, and I think the results, which were published by Vitalité not too long ago, was stunning, where the wait for cataract surgeries in the Acadia Bathurst zone was at 1,465, waiting more than a year. And now that has dropped to 268. And the key is those procedures are being paid for by Medicare. And it has impacted the system in a very positive manner.
But as reported by the CBC, even the doctor who runs that clinic in Bathurst has warned about corporations focused on profits gaining a bigger foothold in the healthcare system. Concerns about profit-hungry companies delivering healthcare services aren't limited to New Brunswick. Critics from across the country argue that private companies will draw health professionals away from the public system, leaving it more understaffed. Meanwhile, Liberal leader Susan Holt says that her party is not in support of healthcare privatization and that privatization would not expand under a Liberal government. In 2017, the government of Liberal Premier Brian Gallant handed over management of extramural and telecare services to Medavie Blue Cross. That company has also run the provincial ambulance service since 2007. Critics say it lacks public accountability because it's a private sector entity.
We certainly want to do some hard looking at that the Medavie contract that the government didn't take the opportunity to do when they should have. They have a foundation, they have a nonprofit arm, they have a for-profit arm. So I'd want to look into those details to make sure that there isn't a profit being extracted from the delivery of those services. I guess our concern with Higgs and Fitch, like you said, is that they seem to be interested in promoting and advancing more private opportunities when we think we should be reducing them.
I asked Susan Holt if the Liberal Party has a credibility problem on this issue, considering their track record on privatization. Here's what she said.
I'm new to this. I'm new-ish to the party. Because I was previously a politically restricted civil servant, a private sector person, worked in nonprofits. So I haven't been a Liberal for a long time. And so I hope they'll give us a chance to demonstrate the change and the refresh that I'm bringing to the party, and the positions that we're taking and the ideas that we're exploring and the work that we're doing now. I can't go back and change the past. I can commit to how we're going to act going forward.